Great. Well, our next panel is on autoimmune disease, and I just wanted to go through, and maybe you each could introduce yourselves and why you're on this panel.
I'm Pavlika. I have two jobs. I'm the SVP of Strategy at Collective Bias, and I also have a blog and community I run called MOMentumNation. And I have an autoimmune disease called Reiter's syndrome, which mostly attacks men who are gay. So, go figure.
I'm Jennifer S. Wilkov. I am a #1 international best-selling award-winning author and award-winning freelance writer. I'm a book consultant for other writers and authors at a company called Your Book Is Your Hook. And I was diagnosed with Crohn's disease at age 11, suffered from it for 25 years and overcame it in 2001 and haven't been on medication since.
Awesome. My name is Jennifer Iannolo, and I have two lives. One is as the founder of a company called Zenfully Delicious, and we really empower people with chronic illness to move past the illness and live deliciously no matter what they're facing. And in my other life, I'm the founder of the Culinary Media Network, which is the world's first food podcast channel. So I'm balancing both of those while managing fibromyalgia, which comes with a lot of food issues. So it's been a really interesting adventure the past 10 years.
Hello, my name is Eliot LeBow. I am a diabetes-focused life coach, as well as a licensed psychotherapist in the state of New York. I was diagnosed with diabetes in 1977, and I have lived with it and successfully managed it for the past 35 years. I also have a practice on the Upper West Side, working with other people who have diabetes, helping them successfully manage their diabetes in their lives. Thank you.
Great. So would one of you actually explain, just for everyone who's watching, what is an autoimmune disease? Does one of you want to take up defining that, and or even from your own experience, what that has meant to you?
Well, they each have their own flavor. When the immune system is worn down, lots of different fabulous things happen with the body. With fibromyalgia in particular, a lot of people ask me, well, what is that? And the easiest way for me to explain it is, it feels like when you're coming down with the flu, so you've got the aches and all of that, but the flu never comes. And so you never really know, are you getting sick this time in the middle of February, or is it just a fibromyalgia flare-up? So it's that combined with a foggy brain, so you forget things a lot. So it really varies on the day, but, based on what's happening with your body.
Well, for type 1 diabetes, which is the autoimmune disorder, type 2 diabetes, which was previously called adult onset, isn't an autoimmune. What happens is the white blood cells attack healthy tissue, and they attack the healthy beta cells. So after that happens, you are no longer capable of producing insulin, because that's what the beta cells do. And so at that point, that's why you have to take insulin injections and manage your sugar and manage your life around taking insulin and eating and balancing the two.
Great. Why don't we talk a little bit about diagnosis? So, you mentioned Crohn's disease. I have friends who have had Crohn's disease and actually who were diagnosed later, one in business school, others later in life. So, when does one, I know it's at different phases, but is this something that an onset of a disease, or something you kind of discover when you're a child?
Especially with IBS and Crohn's disease in particular, but I'm sure it's very common in other autoimmune diseases, is the symptoms are very puzzling. So you have to go through test after test after test after test for them to actually figure out what it is that you have. So with Crohn's disease and IBS, people don't always know that that's exactly what it is the first time you show up.
Yeah.
But you're miserable. And so they can't give you anything to stop the misery. They can only give you a test. And so that's why I think even people who are older who suddenly find themselves with IBS or another autoimmune disease, they're disappointed, I'll call it, initially in the healthcare system because it's not immediately diagnosed.
Interesting. Now, you had mentioned that you're not the profile for
Right.
what you have. So what was that process like?
Well, I had tendinitis in my shoulder, and then I went back to the same doctor because I had tendinitis in my elbow, and she said, do you have anything else any place else? And I'm an athlete, and I've always worked out since I was little, and I said I have plantar fasciitis, so she sent me to a rheumatoid arthritis doctor, rheumatologist. It took 6 months for them to diagnose what I had, because mine it's seronegative, it doesn't show up in the blood. And then they put me on medication. It didn't work after 3 months, and I got mouth sores and had all kinds of issues with medicine. Then they put me on another set of drugs, and those worked, but it took a year to figure out what it was and to get something that actually controls it for the most part.
And you know, we're so short on time, and I want to talk about a lot of stuff, but we talked a little bit backstage about living with the disease and championing your disease versus overcoming an autoimmune disease. So maybe let's talk a little bit about living, championing it as well. So why don't you start?
Well, one of the things about living with diabetes is that it's 24/7. You live with it every day around the clock. And one of the important things about living to really champion it is to accept that it is part of your life. It doesn't make you who you are, and it doesn't have to take over your life, but you do have to manage it. If you manage it and you take care of yourself and you eat well, it doesn't mean that you have to starve yourself or go on some special diet. Just eat well like they taught you when you were in high school or in junior high school, with normal, healthy food, and exercise. And exercise doesn't mean going out and running on a track or going to the gym. It can just mean going for a walk every day, being up and active, instead of taking the subway if you're in New York City or another big city, walking a couple blocks. Making little choices like that will really help manage the diabetes, and when one's diabetes is in control, then everything else in life tends to follow through. So you're going to be who you are, and you're always going to be you. It's just that you have to take care of yourself, and if you put that as priority over everything else will come together.
Great, thanks. Any thoughts on there?
Yeah, I mean, the first few years I really spent a lot of time being angry and fighting this. I didn't ask for this, didn't sign up for it. And it wasn't until I really just owned it and not only took responsibility, but actually, I have a saying for it: when life hands you lemons, don't just make lemonade, make lavender-infused lemon sorbet. So get out there and live your life, and you have a thing, and you put the thing here, and then you go and live your life. So you get to choose. So you can choose to be miserable, or you can choose to really live. So
And I loved when you all introduced yourself, you talked about you have this, but this is your life. So that was great. Holly, any thoughts on where do you fall on the spectrum in terms of championing versus overcoming? Do you believe you can do that? And I'm saving you for last. So.
Yeah, I mean, I just keep going because, you know, I had mine when I've had 2 little babies, you know, so I had to go. I invent things along the way. I've invented stretches. Because of the medicine I'm on, my immune system is lowered, so a lot of times when I know I'm going to have to be in a room with people and they're going to want to shake my hand and it affects my hands, I walk around with Kleenex because nobody wants to shake a hand of somebody who looks like they might have, you know, a cold or something. And this has become something that I use all the time. I roll my feet on it. If I have problems with my piriformis muscles, I sit on it. You know, a $2 baseball is a really great thing for helping to get through bad days.
And Jennifer, I want to come to you. Know, I have friends who have had Crohn's and lupus, and they go through the good times, and then they go through really bad times, and it takes everything to kind of get through it. You had mentioned overcoming your autoimmune disease. Can you tell us a little bit about that?
I'd love to, because I think there's a perception that you're stuck with it. And I just refuse to believe that. And I had it really bad. I have had 2 bowel resections, nearly died on the table on the first one. I was 64 pounds at age 14. So I was a walking skeleton. So I really had it bad.
Yeah.
But something miraculous really happened in 2001, and I was in the ICU after the second bowel resection, and the surgeon turned to me and he ordered me a salad. And I looked at him and I was yelling at him, and I said, "What do you expect me to do with this?" And he said, "I expect you to eat it. Mm-hmm. And I expect you to get out there and eat all the things that you haven't been eating." Because I was told processed is best for years. And I actually looked at everybody, all my family in the room, and I thanked them all and told them I loved them. And I said, now I'm going to cure myself. And I went back from the hospital to my doctor, thanked him, and I said, now I'm going to cure myself and you're going to help me. 6 months later, I was off every drug, every test, every FDA trial, everything that they were trying to do to help me. And I think what's most important about it is when you make a decision that this is yours, you're going to own it, but you're going to live with it in a way that it's not going to affect your life. You have the choice. And I think that's really the key to overcoming it. Whether it's going to be a part of your life or not, you have the power to choose how it's going to be in your life. And I just said, no, I don't want this to be a part of my life. And therefore, I even became a vegan at one point. And I had the best health ever. And most people who have IBS or Crohn's disease are cringing right now, but it really helped me a great deal.
And do you, we're ending, but in terms of lifestyle, stress, good food, exercise, I'm assuming all of that is very important. Yeah?
That's it.
Yeah.
And taking care of yourself in other ways besides just food and exercise, treating yourself to massages, going to therapy, getting the emotional health is really important, and getting help is crucial when you're living with an autoimmune disorder.
Okay. Thank you, everyone.
Thank you.